How too much sleep can negatively affect you. You need your sleep, a solid 8 hours per night, the experts say. Stop burning through the midnight oil, they say. Everybody who's an expert warns you that you should not be sleep deprived. But very little is said about the effect of sleeping too much. Is there even something like getting too much sleep? And if so, is it even a problem? Too much sleep. Defined. The amount of sleep we need in various stages of our lives varies significantly over time. Newborns sleep the whole day. An average adult requires at least 7 hours of sleep every night. The amount of sleep needed is dependent on your daytime activities, overall health, and general sleeping patterns. It's not abnormal for athletes to sleep a little more, as their bodies need extra recovery. You may need a little extra shut-eye after doing some strenuous activities or after traveling. A good night's sleep is known to promote overall health and mental alertness. Too little sleep causes sluggishness and an inability to focus properly. The simple term we use is oversleeping. Medically, it's called hypersomnia. Even when you sleep for a mere 9 hours each night, your behavior could be classified as a sleep disorder. The condition is characterized by oversleeping on a regular basis, as well as experiencing excessive sleepiness during the day, despite a long night's rest. In some cases, you may also have constant headaches. The importance of getting the right amount of sleep is so cardinal that you even get institutions called sleep foundations, and many sleep experts spend their valuable resources, time, and energy to study this field. Causes of oversleeping. When medical experts cannot determine the cause of your oversleeping, they call it idiopathic hypersomnia. However, there are a number of medical conditions that can cause oversleeping and excessive daytime sleepiness. These illnesses include sleep apnea, narcolepsy, depression and anxiety, obesity, cardiovascular disease, diabetes, chronic pain, and hyperthyroidism. A special category of people is those suffering from restless leg syndrome, a brain disorder that causes an overwhelming urge to move your legs while sleeping. Chronic pain will also cause you to sleep badly and thus need more hours of sleep each day to feel rested the next morning. Conditions like narcolepsy, a brain disorder that interferes with the body's sleep-wake cycles, and bruxism, where you grind and clench your teeth during sleeping, will greatly influence what you would call your usual sleeping patterns. Don't lose sight of the fact that oversleeping can also be caused by the use of substances, such as drugs and alcohol. Even prescription medicine can cause you to oversleep. Effects of oversleeping. Your body will surely respond to the effects of oversleeping. Here are some of the negative effects you may observe. Negative impact on the immune system. Too much sleep has a negative effect on your immune system. Too much sleep can cause or worsen inflammation in the body. When the immune system is under constant attack, it can lead to chronic disease. Both sleeping too little and sleeping too much are associated with obesity, mental distress, coronary heart disease, diabetes, and strokes. Like in the story of the three bears, it seems like your amount of sleeping should be tuned to just right. Constant headaches. Researchers have found that when a person sleeps too much, the neurotransmitters in the brain are interrupted, including the secretion of serotonin. This disruption makes a person prone to headaches. Disruptive nighttime sleep may result in you waking up with a headache in the morning. Back pain. People already suffering from back pain should abstain from sleeping too much. By maintaining a higher level of activity, your back will benefit much more. Contrary to instinct, don't rest your back by going to bed. An upright back walking around will relieve back pain. Mental health. Oversleeping can cause symptoms of anxiety as well as memory loss. Because these symptoms occur constantly over time, there's a cyclical effect. Your normal stress response will also be affected in a negative way. People with mood disorders are between 3 and 12 times more likely to oversleep on a regular basis, resulting in them perceiving and experiencing poor quality of life. Fatigue. Instead of feeling refreshed and full of energy after sleeping much longer, you may experience the opposite effect. Your energy levels may feel much lower, while your fatigue levels will increase even further. Heart health. When you sleep too much, it impacts the process where your blood vessels and heart repair itself at night. Obesity. Too much sleep will do nothing to help you get rid of excess weight. Instead, your metabolism will slow down and hang on to fat deposits, saving it for a rainy day. Determining if you have a problem. Newborns sleep between 14 and 17 hours per day. Preschoolers can average between 10 and 13 hours. Teenagers vary greatly because of activity levels and lifestyle and can do between 8 to 10 hours. Most adults do between 7 and 9 hours per night. By keeping a sleep diary, you can record the number of hours you sleep per night as well as how often and for how long you wake up. Taking notes of the number of naps you take daily will give you a strong indication of whether it's normal or out of control. When you have this data available and you feel you need medical intervention, your doctor can get a good indication of how to start treating your symptoms. Tips to improve your sleeping patterns. Start with setting a regular sleep schedule. If you start going to bed at the same time each night, it'll help your body to adapt, and you'll not be sleep deprived when you wake up in the morning. Establishing a bedtime routine, the predictability will help your body and mind to relax more easily. Avoid all electronics and sharp lights for at least an hour or two before bedtime. Change the setting of your bedroom to soft lights in order not to delay the onset of sleep. Also, make sure that you have the right amount of blankets and bedding that is suitable for the weather and seasonal changes. If you can block out unnecessary noises, it will greatly aid a good sleep environment and routine. The darker the room, the better you will sleep. An active lifestyle filled with exercise and sunlight will do wonders to contribute to a good night's sleep. Avoid naps in the late afternoon, as it may impact your ability to fall asleep at your set bedtime. Avoid drinking alcohol or caffeine too close to bedtime. Your regular bathroom breaks at night are disruptive to your sleep, so don't make things worse for yourself. Practice good sleep hygiene. Try to go to bed at the same time each night and get up at the same time, including on weekends and holidays. Kick the habit of hitting that snooze button. Instead, only set an alarm by which you have to get up. If you need to, put the alarm away from your bed so that you have to get up and out of bed to stop the alarm from buzzing. Finally, there are some people who just love to sleep a lot. About 2% of the world's population are so-called long sleepers, who require between 10 to 12 hours of sleep per day on a regular basis. To them, sleeping is one of their favorite hobbies or pastimes. They sleep in any place at any time, as if they don't have a care in the world. You can decide whether you count them lucky or unlucky. If you learned something completely new and enjoyed today's video, we would love to hear from you. Hit that notification bell, as that should be one of the alarms you don't miss when we release new content. And please subscribe to our channel. See you in our next video.